Biological bases of behavior disorders. Chapter 16, this is well, there's two branches of psychology. There's positive psychology, and then there's the traditional psychopathology branch of psychology, looking for problems that people may have. So let's go ahead and get started. Okay. According to a study in the National Institute of Mental Health in 2005, 32.2% of the population in the United States will have a psychiatric disorder sometime in their lives. That's 1 out of every 3 people in the United States. Within any given 6-month period, 19.1% of the population suffers from a psychiatric disorder. It's the same NIH study, 16.4% of the U.S. population will suffer from some form of substance abuse in their lives. That's 16.4%. 6% have suffered from some form of substance abuse within any 6-month period. 13.3% of the population will suffer alcohol abuse or dependence in their lives. 4.7% have suffered alcohol abuse or dependence within 6 months. Now, this is 2005. This is before the opioid epidemic hit the United States. So these statistics may be a little bit different now in 2024. That's almost 20 years ago. 5.9% of the U.S. population will suffer from drug abuse or dependence in their lives. 2% have suffered some form of drug abuse or dependence within any 6-month period. 1.5% of the U.S. population will suffer from schizophrenia in their lives. 0.9% have suffered some form of schizophrenia within any 6-month period. How many people are there in the United States? About 317 million people. So what does that mean? About 1% of the population have it. That's 3.17 million people. 3 million people suffer from schizophrenia. 8.3% of the U.S. population will suffer from an affective disorder, manic or depressive episodes in their lives. 5.8% have suffered some form of affective disorder within any 6-month period. 0.8% of the U.S. population will suffer from a manic episode in their lives. 0.5% have suffered some form of manic episode within any 6-month period. 5.8% of the U.S. population will suffer from a major depressive episode in their lives. 3.0% have suffered some form of major depressive episode within any 6-month period. 33% of the U.S. population will suffer from minor depression in their lives. An undisclosed number will suffer some form of minor depression within any 6-month period. 14.6% of the U.S. population will suffer from an anxiety disorder in their lives. 8.9% have suffered some form of anxiety disorder within any 6-month period. 12.5% of the U.S. population will suffer from a phobia in their lives. And this lady's afraid of insects, and she's got a butterfly on her head. 7.7% have suffered some form of phobia within any 6-month period. 1.6% of the U.S. population will suffer from a panic disorder in their lives. 0.8% have suffered some form of panic disorder within any 6-month period. 2.5% of the U.S. population will suffer from an obsessive compulsive disorder in their lives. 1.5% have suffered some form of obsessive compulsive disorder within any 6-month period. A study by Kessler and his colleagues in 1994 disclosed that almost half of the population would suffer from a psychiatric disorder in their lifetime. This is in 1994. We just saw that it's about a third now. That was half. So a little bit different in 1994 than in 2005. 30% of his respondents reported a psychiatric disorder within the previous 12 months of the survey. At the turn of the 20th century, 20 to 25% of all inhabitants of mental hospitals around the world suffered from delusions, grandiosity, and euphoria, poor judgment, impulsive and capricious behavior, and profound changes in thought structure. And we weren't exactly sure why. Then in 1911, this problem was identified as syphilis, a sexually transmitted infection. Since the development of antibiotics, the number of people suffering from paresis has been reduced to zero. It's something that we don't see anymore. So what is paresis? So what is syphilis? Syphilis is a bacterial infection that spread through sexual contact. It is caused by what we refer to as a spirochete. And this is a spirochete right here. This is the shapes of all of the bacteria known to human habitation right now. These are cocci, these are rods, these are diplococci. This is a spirochete. That's a spirochete, and this is a spirochete. When I first started in medicine in the early 1970s, this was still a relatively common problem. We weren't seeing it nearly as much as we had before because we had antibiotics that could treat it. But I was trained to see these bacteria if I was looking for a potential syphilis problem, and that's what it looks like under the microscope. This is what it looks like under an electron microscope. Of course, back in the 70s, very few electron microscopes, but under a normal microscope, this is what you would see: a spirochete. Most psychologists consider schizophrenia the most serious of the mental disorders. Schizophrenia is known in every culture around the world. 1.1 to 2% of any population will suffer from symptoms of schizophrenia, and as we just said, or as I just said, that's about 3.17 million people in the United States suffer from schizophrenia. Well, the description of the symptoms of schizophrenia has changed over the years, and I've got a abnormal psychology book from the 1970s somewhere, and it's so totally different than it is today. The symptoms themselves have remained basically the same. There are positive and negative symptoms. The positive symptoms mean something is added: hallucinations, delusions, excited motor behavior. Negative symptoms mean that something has been taken away. So you have a total personality. Something has been taken away from the personality. In this case, we're talking about slow and impoverished thought and speech, emotional and social withdrawal, blunted facial expressions. So the positive things are things that have been added to the personality. The negative symptoms are things that have been taken away from the personality. If schizophrenia is genetic, then relatives of schizophrenics should have a higher incidence of schizophrenia than the public at large. While the general population has 1 to 2% incidence rate, parents have an incidence rate of 6%, siblings 9%, and half-siblings 6%. The closer the relationship, the greater the risk. And this is what a patient suffering from schizophrenia acts like, I think, if this is still viable. Nope, video's gone. Okay. Sorry about that. Comparing monozygotic and dizygotic twins, monozygotic twins have an amazing 48% incidence rate, while dizygotic twins have a 17% incident rate of schizophrenia. Monozygotic, of course, are two individuals that come from the same egg. Dizygotic twins are two individuals that come from two individual eggs, but they grow up in the same environment, in the same placental environment. Children of schizophrenics have a 13% incidence rate. So just because your mother or father has schizophrenia, just because your brother and sister has schizophrenia, even if your identical twin has schizophrenia, you still have a 52% chance of not developing schizophrenia. Just a second, let me get my arrow back. And there you go, monozygotic. That means from the same egg, dizygotic from two different eggs, but growing up in the same placental environment. Work by E. Fuller Torrey has shown that when one twin is different, it is observable early in life. Research by Torrey looking at discordant monozygotic twins shows that the twin that develops the schizophrenia is the lowest birth weight and the one who is most abnormal throughout life. And I have a niece that has been diagnosed with schizophrenia, and I can tell you that throughout her life there were a lot of differences between her and she was about the same age as my son. They were 2 months apart, I think. Their birth dates are 2 months apart, and she never smiled. She was always upset about this, that, or the other. And my son is just the jolliest fellow you ever saw. So it was really quite obvious. You can see it in pictures. She's never smiling in a picture. Um, it's really kind of fascinating looking back at old photographs. Elaine Walker looked at monozygotic twins in a similar manner. Walker proved that even the least indoctrinated layperson could pick out the future schizophrenic twin from home movies. This they were able to do with uncanny accuracy. Even the accuracy that they showed was more accurate than a trained psychologist, actually, as weird as that may seem. Work by Levy et al. In 1993 and Stuve et al. In 1997 demonstrated that individuals suffering from schizophrenia are unable to follow a slow to and fro movement, such as the pendulum of a clock. And this is one of the ways that they diagnose schizophrenia. Schizophrenics tend to have their eye movements interrupted with jerky eye movements called saccades. And this is what you and I do when we're watching something moving back and forth. And this is what we see with somebody suffering from schizophrenia. Work by Ketty and her colleagues in 1975 and again in 1994 looked at the psychiatric histories of adoptees and their biological and adoptive parents. Ketty et al. Discovered that the adoptees who suffered from schizophrenia, the biological parents, were far more likely to suffer from schizophrenia than the adoptive parents. And actually, Ketty is not a her, Ketty is a he, and that is Ketty right there. Combining the twin families and adoptee studies, many researchers have concluded that there is a genetic factor in schizophrenia that is inheritable. What structures are being inherited, what structures are involved, which genes are being inherited, and what processes do they control? That's one of the questions that we are trying to answer. While autopsies are often found enlarged ventricles in the people suffering from schizophrenia, that's the open area of the brain, that we all have them. We all have ventricles. That's where our cerebrospinal fluid comes from. It wasn't until the brain imaging techniques, the CAT scans and MRIs, that this was confirmed in living patients at all stages of the disease. There is always a question if an effect is caused by the disease or the effects of the disease are causing the problem. Dietary limitations, of course, prolonged stress, the toxic effects of antipsychotic drugs could be causing the enlarged ventricles. The more advanced the case, the greater the enlargement of the ventricles. The larger the ventricles, the poorer the response to antipsychotic drugs. Research has also shown that lateral ventricles tend to be the most likely to be affected. And this is a person, these are two identical twins. There is a ventricle here, this is a ventricle, and that is a ventricle. This is the individual suffering from schizophrenia, the identical twin, and you can see that the ventricles are much larger in the individual suffering from schizophrenia. Discordant twin studies where one twin has schizophrenia and the other doesn't showed that in 75% of the cases, the hippocampus and amygdala were smaller in the schizophrenic twin. Researchers speculate that the enlarged ventricles and smaller brain structures denotes atrophy of neural tissue. Looking deeper into the hippocampus, researchers have discovered that the pyramidal cells of people suffering from schizophrenia are disorganized in the sufferer as compared to the normal individual. The degree of disorganization relates directly to the severity of the disorder. This is what it normally looks like in your hippocampus. These are neurons in a pyramidal structure, so it's a columnar. In other words, so if you have a thought and the thought comes from here, it follows the neurons down. So this tells you you're trying to remember who played first base for the San Francisco Giants in 1963, and you remember that it was Willie McCovey. Or did I get that? Well, that's down here. This is San Francisco Giants 1963, and it comes down the column. Now, if I were suffering from schizophrenia, and I started to think about who was the first baseman for the San Francisco Giants in 1963, I would try to follow it down, and all of a sudden I would end up with Catfish. Why? Because it doesn't follow a normal structure. So their memory process is disrupted by this disorganization of the pyramidal cells. And there we go. That's what we just saw. That's what we were just looking at. This is a normal organization of your brain. This is what makes you brilliant. This is what makes you remember things. And this is what happens when you have schizophrenia. Now, one of the problems that we are arguing about right now, this has to do with artificial intelligence, is the fact that people are thinking that they don't have to remember things anymore. It's not important. I don't remember telephone numbers. I don't have to remember telephone numbers. It's in my smartphone. So maybe we don't have to remember anything. Maybe we can look everything up. Well, unfortunately, what might potentially happen is this. We will not have this as much because we're not practicing memory. Therefore, the columns that we had before are gone and we can't remember things. So we may be creating a world that is more disorganized, where we can't remember anything. Macon and her colleagues speculate that this derangement in the hippocampal pyramidal cells occurs due to maternal exposure to the influenza virus during the second trimester of pregnancy. Okay, so when is the flu prevalent? The flu is prevalent in the fall. So that means somebody who was their second trimester, that means they got pregnant in, they got pregnant in the summertime, and then they gave birth in the spring, are more susceptible to schizophrenia than someone who was born. My birthday is in October, therefore my mother got pregnant with me in February. You add and subtract 9 months. I was a full-term baby, so obviously she gave birth to me in November. Now, if she had had the flu in February, March, April, that's okay. It's in the first trimester when the brain isn't organizing things. But then again, so in her second trimester, that was April, May, June. That's her second trimester. There's not a whole lot of diseases out there, and that may be one of the reasons why I don't have schizophrenia. Hot dog. Looking at blood flow in the brain during the resting state, researchers have discovered that in the brain of a schizophrenia sufferer, the left hemisphere is more active than the right hemisphere in the frontal lobe. PET scans indicate that people suffering from schizophrenia have less metabolic activity in the frontal lobe. And there you go. And this is the normal control. You can see how active everything is, and we can see how inactive this guy is. Much of the proof that dopamine is a neurotransmitter that is the cause of the symptoms of schizophrenia comes from pharmacological studies. Tens of thousands of schizophrenia sufferers were able to leave psychiatric hospitals when chlorpromazine was discovered. Chlorpromazine and the phenothiazines block D2 type receptor sites. That's the dopamine receptor sites in the hippocampus. Due to the pharmacological evidence, it seems that the effectiveness of antipsychotic agents is directly related to the magnitude of postsynaptic receptor blockade of dopamine sites. So the better you can block the dopamine receptor sites, the more you can take away the symptoms of schizophrenia. Parkinson's disease is caused by the degeneration of nerve cells in the substantia nigra, which contain dopamine. So an overabundance of dopamine causes schizophrenia. An underabundance of dopamine causes Parkinson's disease. When a patient is given too much L-DOPA to compensate for the lost dopamine, they develop schizophrenic-type symptoms. Some schizophrenic patients will develop Parkinsonian-type symptoms if over-medicated with phenothiazines. So we are trying to regulate the dopamine level here, and if we give the Parkinson's patient too much L-DOPA, which increases the dopamine in their brain, it causes schizophrenic-like symptoms. If we take a patient suffering from schizophrenia and we give them too many phenothiazines, which takes away the dopamine receptor sites, takes away their reaction to the dopamine receptor sites, then what we see is that they develop Parkinsonian symptoms. So if we don't medicate people properly, then we are either giving the Parkinsonian patient schizophrenia, or we're giving the Parkinsonian patient, the sufferer of Parkinson's disease, we're giving them schizophrenia. However, some schizophrenia sufferers treated with dopamine inhibitors do not respond. Recently, a new generation of antipsychotics have been developed that do not affect just dopamine levels, and they still work. These new drugs are referred to as atypical. Clozapine is an atypical antipsychotic drug that not only blocks dopamine receptors, but serotonin receptors as well. Clozapine actually seems to increase dopamine reception in the frontal cortex. One theory about the development of schizophrenia is that select chemicals build up or are created in the brain that causes psychosis. These substances are referred to as psychotogens, literally brain monsters. And that's what a brain monster looks like. One theory is that an addition of a methyl group in the brain chemistry can cause a conversion of normal compounds known as hallucinogenic agents. This is known as the transmethylation hypothesis. Methyl crossing process is what transmethylation means. Methyl crossing process. So an increase of this methyl group is creating a chemical structure that is causing the schizophrenia. The psychobiological model of schizophrenia emphasizes that there may be several factors interacting that cause schizophrenia. Each life phase of brain development provides potential triggers to the development of schizophrenia. People genetically predisposed with brain abnormalities may or may not experience the proper triggers in the correct sequence to create the conditions for schizophrenia. Viral illnesses such as influenza and inoculations may be part of the trigger. The stress of urban life as compared to rural life shows that more people per capita have schizophrenia in urban settings compared to rural settings. Thus, schizophrenia may emerge when the combination of life stressors are added to the neurologic triggers and the genetic brain abnormalities. Okay, now we're going to talk about autism spectrum disorder. Autism is a lifelong developmental disorder. It's characterized by impaired social interaction, impaired language, a narrow range of interests and activities. They may perseverate which is a word that comes from persevere. Head nodding, constant head nodding, ritualized finger movements. And that's what this young gentleman is doing. He's rubbing his fingers together. They have difficulty judging other people's thoughts and feelings because they do not look at your face. Autism seems to have a strong heritability. It occurs in 1 to 2 children per 1,000. It is far more common in males than in females. A study by Rodier in 2000 demonstrated a common abnormal allele on the Hox gene of the 7th chromosome, reduced size of the corpus callosum, reduced size in select cerebral regions. There you go. Reduced size of the corpus callosum in autism. This is a normal corpus callosum, sorry. And this is an individual with autism. So the communication between the two hemispheres of the brain is not quite as good. While periods of unhappiness affect everyone from time to time, prolonged chronic depression occurs most often in people over 40 and women 2 to 3 times more frequently than men. Depression is not sadness, but is characterized by unhappy moods, loss of interest, energy, and appetite, difficulty in concentration, restless agitation. Depression may not be triggered by any apparent stress. Without treatment, it may last for months. Depression may afflict 13 to 20% of the population at any one given time. Bipolar disorder is diagnosed when someone who suffers from depression also displays episodes of excessively expansive moods, which include sustained overactivity, talkativeness, increased energy, and strange grandiosity. And possibly we will see what it looks like right now. Great. Political cartoon.
Liberals have a plan to make Puerto Rico a state, adding 2 Democrats to the Senate.
Bipolar disorder seems to get a bad rep, but a lot of people in the public eye have come forward and bravely discussed their struggles with the condition. So what exactly is bipolar disorder? Hey guys, Julia here for D News. If you're as big of a fan of Demi Lovato as I am, you know the confident singer is an outspoken activist for mental health issues. Several years ago, she came forward and admitted to her own struggles with bipolar disorder, formerly known as manic depression. Even as the disorder becomes more of a focus in the public eye, a lot is still misunderstood. Bipolar disorder is most known for the way it affects people's moods. It often creates an uncontrollable change in moods that can impact daily life for the 3% of Americans with the condition. While researchers aren't sure what causes it, the risk factors for bipolar include genetics and environment, things like stress, substance abuse, and even lack of sleep. But really, it can affect anybody. What a lot of people don't understand is that bipolar is more than just a single diagnosis. There are different categories, almost a scale of bipolar disorder. The symptoms vary from person to person. Some people's manic episodes leave them feeling exuberant and energetic. They feel really creative, like their brain is working faster than usual. This is usually less severe than mania and is classified as hypomania. In others, mania can make them go without sleep for 3 days or gamble away all their savings. There's type 1, which is what most people think of when they think of the disorder. Its symptoms include extreme manic episodes in which someone acts more erratic than usual. They have grandiose ideas, an exaggerated sense of importance and skills, higher sex drive, and higher impulsivity. While the highs are really high, the lows are just as extreme. People with type 1 have periods of extreme depression too. Bipolar 2 is similar to type 1, but low moods tend to dominate with less frequent episodes of less extreme hypomania. Rapid cycling, just like it sounds, is when someone goes through 4 or more periods of manic or depressive episodes in a 12-month period. Yet another type of bipolar disorder is cyclothymic, which has several less extreme manic episodes and less extreme depression. But no matter what type, bipolar disorder is mostly characterized by the swinging of moods from low to high. Sometimes these moods can last for weeks or months, other times they're as short as days. And to some, you would think the high episodes sound great. Who wouldn't want to feel important, smart, and driven with a flight of ideas? It's these kind of moments that make creative people with the disorder so productive. Many creative types, painters, writers, even actors have been diagnosed with some type of bipolar disorder. I've talked about this link before in another episode, but like I said, there's a downside too. Sometimes those grand ideas include delusions, like taking over the government or winning the jackpot at poker. Both the highs and lows can be very disruptive to someone's life. One study published in the journal Nature found that some people with bipolar disorder are more sensitive. Essentially, their brains are literally more sensitive to stimuli than others. In the study, researchers took skin cells from participants, turned them into stem cells, then coaxed them into becoming neurons. They found that some people's neurons are physically more sensitive when stimulated than others. Other imaging studies found differences in the brains of those with bipolar disorder. One study published in the journal Molecular Psychiatry found differences in white matter and in the cerebellum. The researchers used an MRI technique that searches for signatures of certain byproducts of cell metabolism. This technique found higher readings of white matter in the cerebellum in those with bipolar disorder than those without the condition. The research also found that there were no differences in the cerebellum in those participants with bipolar who were taking a common form of treatment for the condition called lithium. Lithium is just one of several effective treatment options, like other mood stabilizers, including valproate. According to a review published in the journal Current Opinion in Psychiatry, even some anti-seizure medications have been shown to be effective in treating the condition. Beyond medication, different types of therapy help, like cognitive behavior therapy, which helps patients build a toolkit of sorts for dealing with dysfunctions in thought patterns and information processing, or interpersonal and social rhythm therapy, which helps patients figure out how their routine and social situations affect their moods. Many people with bipolar disorder go on to live wonderful, healthy lives, but it starts with getting help. Check out resources like the Depression and Bipolar Support Alliance at dbsalliance.org. Art and creative outlets also help many people with psychological conditions heal. But what is the link between creativity and mental illness? Find out more in this episode right here. Some studies find a higher incidence of mental disorders in those in creative fields, and especially in those individuals who've reached some notoriety or eminence. Other studies find a higher incidence of mental disorders in the family members of creative people. These results strongly hint at a genetic link. So do you have any other questions about psychology or the way our brains work? Let us know down in the comments below. Don't forget to hit those like and subscribe buttons and keep coming back to D News so you don't miss a single episode.
That was weird. She changed her clothes right in the middle of things.
I got the fastest
There we go. Okay, anyway. Depression may lead to suicide. Estimates are that 80% of the people who commit suicide are profoundly depressed. While suicide rates overall are decreasing in the Western Hemisphere, disturbing indications are that suicide in the younger population is increasing. Increased use of drugs among youth may be causing the suicides. Looking at concordance studies, the incidence of depression is much higher among dizygotic as monozygotic twins. Concordance studies of monozygotic twins raised apart shows equally similar results. These studies point to a strong heritability of depression, and I apologize for having the Olsen twins. One of them just had a baby. I can't remember which one. Anyway, depression is common in select medical conditions, especially those that involve the endocrine system and brain disorders. Cushing's syndrome is caused by lesions in the pituitary gland that cause an excess amount of ACTH and hence cortisol. The first symptom is depression, followed by obesity, unusual growth and distribution of body hair. And this is an individual who's suffering from Cushing's syndrome. Wait a minute, let me get my arrow back. Sorry. There you go. And as you can see, she's gaining weight. We can't see her hair growth, but she's gaining weight due to Cushing syndrome. Parkinson's disease, 50% of the people who suffer from Parkinson's disease suffer from depression that can be attributed to no other symptom. This may be due to lowered levels of serotonin from loss of neurons in the dorsal raphe nucleus, where large amounts of serotonin are stored. What are we talking about? Oh, Parkinson's disease. I have I hold a record, a relay record, with an individual who was very, very fast, a lot faster than I was. He still holds the sprint records, the 100-yard dash and or 100-meter dash, and the 200-meter dash. But we also together hold the 400-meter relay record. and he died of Parkinson's disease last year, despite the fact that he was this fabulous athlete, suffered from Parkinson's disease. Phil Allen was the guy's name. He was just an amazing athlete. Respirine, a drug that causes monoamine oxidase, that increases monoamine oxidase, and thus depletes serotonin and norepinephrine, causes profound depression. Some researchers have looked at these effects and they point to increases in monoamine oxidase as the cause of depression. Electroconvulsive therapy also reduces depression by reducing biogenic amines, which reduces the amount of monoamine oxidase in your brain. All around the world, more women than men suffer from depression at a rate of near 2 to 1. Several interesting studies show that rates may actually be closer to the same for men and women. A study of depression rates among the Amish shows men and women with similar rates. What is the intervening variable? Amish men do not drink alcohol. Men are more likely to self-medicate with alcohol than women are. Therefore, a lot of people who are drinking, who drink to excess, may be drinking due to depression that they are trying to control. Sleep studies of depressed patients shows that people suffering from depression spend much more time in stages 1 and 2 and much less time in the more restful stages of 3 and 4. This means that depressed people jump into REM episodes much earlier than people with normal sleep patterns. REM sleep seems more intense for the depressed. Studies show that the shorter the time that it takes to go into REM, the more severe the depression. One of the effects of antidepressant monoamine oxidase inhibitors is the fact that it reduces your REM sleep. Research by Anaveros and his colleagues found that 40% of the people they tested had abnormalities in their temporal lobes. Even in a resting state, these individuals have increased activity in the hippocampal area, an area known to induce fear when stimulated. We're talking about panic attacks. The most common treatment of anxiety is the pharmaceutical benzodiazepine, such as diazepam or Valium. Benzodiazepine works because it changes the permeability of the neural membranes of the chloride ions. Membranes to the chloride ions. Therefore, more chloride get into the neurons, especially those that react to GABA. The influx of chloride ions inhibits the firing of the neuron, making it less likely that you will be anxious because there's more chloride ions from the gamma-aminobutyric acid. So since there's more chloride ions in your neurons, then the nerve isn't going to fire. It's less likely to be afraid. Studies of individuals suffering from PTSD have shown that on the average, their right hippocampi are 8% smaller than people without PTSD. High levels of circulating glucocorticoids from the chronic and intense stress of the PTSD may have caused the cell loss in the hippocampus. Research looking at OCD has found that sufferers have increased metabolic activity in the caudate nucleus, the left orbital gyrus, and the left anterior cingulate cortex, and bilateral orbitofrontal cortex. Increased serotonin levels decrease the OCD symptoms, especially tricyclic medications and clomipramine. Tourette's syndrome is a tic disorder. These individuals seem to be unable to stop themselves from motor tics, that has to do with movement, vocal tics, speaking out, which is not actually that common. We think of people with Tourette's syndrome swearing all the time. Well, that's not always the case. It's actually rarely the case. The average age of onset is 6 to 7 years. These children may also have problems with ADHD and obsessive compulsive disorder. There's a single gene that caused the problem. Concordance rates of monozygotic twins is 53 to 77%. Indications are that dopamine receptors, are the D2 receptors, of course, are more sensitive in these individuals, causing involuntary movements and involuntary verbal explosions. This is mad cow's disease. It's in humans. It's referred to as encephalopathy, bovine systemic encephalopathy. It's caused by prions, and this is a normal protein, and this is a prion. As you can see, it's very disorganized, and this is what happens in the brain. There are prions, and the prions cause the area to die, and then you get spongiform. That's what it is, bovine spongiform encephalopathy. Sorry, it makes it look like a sponge. So if we take a look at a human brain, this is a normal human brain is fine. Everything's stuck together. The proteins are holding things together. But with prions, which is a mutated type of protein, it kills that area, and it makes it look like a sponge because it has holes in it like a sponge does. Bovine spongiform encephalopathy. And that is the end. Oh, wait a minute. Wait a minute. I have a film on mad cow's disease. This is not a pretty film, by the way. Oh, it's gone. Okay. It was from England. Yeah, this was a common problem that they had in England. The problem was that they were, the central nervous system, the brains and of course, if they have prions, it's a mutation. And if the prions are introduced, then it will infect the brains of whatever comes in contact with it. So if you eat the brain of an infected cow, then you will get you will have this problem as well. It will affect your it will affect your protein as well. And so there was a problem with this in England. They were using the central nervous system. They were taking all the parts of the cow and they were doing whatever they were doing with it. And then they were taking the leftover parts and they were mixing it in the feed of other cows, for cows. The brains and some of the bone. They're grinding the bones up, and they were making it into cow feed. And of course this caused a really serious problem. They started having cows, their central nervous systems were breaking down because their brains looked like this, spongiform, bovine spongiform encephalopathy, or mad cow's disease. And this is also a similar situation. This is an individual suffering from bovine spongiform encephalopathy. This is one. I'm sorry. This is a human brain. This is what causes the mad cow's disease. But in humans, it's Jacob-Creutzfeldt disease. And it's the same stuff, actually. So one of the things that happened was that the Brits were selling their feed to the Canadians. And the Canadians, of course, some of this stuff was really infected. So that's one of the reasons why we stopped allowing beef from Canada to come into the United States. And I think it's still intact. We haven't seen any of this for a long, long time. There was a problem with buffaloes coming off the Yellowstone. Some of them had mad cow's disease. That was a problem. There was another problem. So they stopped it. Of course, it kills the cow fairly quickly. I mean, they can't really function if they can't stand up. So they die. But what was happening was the farmers, seeing that their profits were going down the tubes, were taking these to the slaughterhouse anyway. And of course, that's one of the things they look at especially in the United States. So the states that were close to Canada, they had to really watch the slaughterhouses to make sure they didn't have a cow with a neurological problem. If they did, they couldn't butcher them, of course. And now in the United States, they do not use spinal column or brain products in any human feed. I can remember when I was growing up seeing cow's brains. A lot of people ate cow's brains, but we don't anymore. You'll never find it in a butcher shop. Anyway, that's mad cow's disease. It's been around for about 30 years. They saw Jacob's Creutzfeldt disease in New Guinea with the headhunters in New Guinea. They were eating the brains of their victims, and it was causing Jacob's Creutzfeldt disease. Killed off whole populations of individuals because of this problem, Jacob's Creutzfeldt disease. Anyway, that's it. We'll get out of here, maybe. There we go. Okay, I'll talk to you again next week. I can't remember what we tackle next week. It's going to be something else that's just a ton of fun.